Aysuda Kölemen is going to present the fourth group, which was Public Discourse and Authoritarianism. Aysuda received her PhD from the University of Georgia Athens in the USA. Her research interests include public opinion and discourses on redistribution, politics of new religiosities, and democratic backsliding. She's currently working on authoritarianism and civil resistance in Turkey. She coordinates the Threatened Scholars Integration Initiative at Bard College in Berlin.
This is going to be about public communication, public opinion, and authoritarianism and how they're all interconnected. We'll keep it very short. Basically, what we've seen here during the pandemic was a failure of policies mostly related to undemocratic measures around the world, even in democratic policies, but more so, of course, in undemocratic, backsliding, autocratic regimes. In case of a pandemic, the state of urgency, the feelings of fear and lack of preparedness pushed governments to take measures that did not necessarily work, where there was no scientific evidence, and in some cases there was scientific evidence against the implementation of those measures, such as surface disinfection and school closures for children. These are results of power structures, class, country, and regional biases, as well as I said, the sense of fear and urgency. So what can we do to prepare for the next pandemic and prevent these things? Especially in terms of communication, we can have certain demands from the government before the pandemic as a continuation of pandemic preparedness. We should also have communication preparedness. We should demand transparency about how we're preparing for the next health crisis, because this is not an event, this is a process, and the communication should be a process as well. And the communication should be transparent. That means any planning should be completely transparent. And the planning should take into consideration the benefits as well as the costs of everything that will be implemented in case of a policy, of a measure, and how these will affect different segments of the population and how these measures will affect different countries and different nations and different populations, particularly vulnerable populations. And all these measures should be, the measures that will be implemented, that can be implemented, should be justified by using scientific evidence, by being discussed by the public and seeing their feedback into how that would affect their lives. Finally, during this process of interactive communication, mutual communication between the governments and the people, and international communication, we should be very clear about what is done, because what was done during the pandemic will be repeated otherwise. A lot of information was obfuscated. There was a lot of very scientific, evidence-based information mixed with, feeling-based policy making. And we should get very clear communication from the governments and agencies, international agencies. And we should actually demand more transparency from international agencies because they don't have any, there's this big democratic gap there. They're not elected by us. And transparency should also be accompanied by conciseness of information. Because if you follow policy proposals and reports that are hundreds of pages and recommendations that are thousands of pages, nobody will read or understand them. So we want clear, transparent, and concise recommendations with evidence-based justification that takes into consideration costs and benefits, societal, not just for healthcare, of these policies for various groups around the world and within countries. Thank you.